From the first quarter of 2026, mobility scooter users on public paths will be required to obtain a certification of medical need from a doctor, Senior Parliamentary Secretary for Transport Bayam Keng announced in Parliament on Wednesday. The Ministry of Health will issue guidelines to the medical community ahead of the implementation. The new rules stem from recommendations by the Active Mobility Advisory Panel, following a rise in cases of able-bodied individuals misusing personal mobility aids, which are meant for those with mobility impairments. We need these new rules to improve path safety, especially for vulnerable users like young children and seniors, Bay said. A new assessment for mobility scooter will be introduced in the fourth quarter of this year, restricting mobility scooter use to individuals with medical conditions affecting their mobility. Those who previously received a subsidized mobility scooter under the Seniors Mobility and Enabling Fund or the Assistive Technology Fund will be automatically certified. Others, including those with non-subsidized mobility scooters, will need to visit their regular doctor for an assessment. First-time buyers of subsidized mobility scooters must obtain an AMS certification from a doctor or occupational therapist before purchasing one. Bay assured that there is no immediate need for PMA users to seek certification, as a transition period will be provided. He said that users would be given time to obtain the certification, and enforcement officers would engage and educate users on the new rules during this period. The certification requirement will not apply to users of motorized wheelchairs, which fall under a separate category of PMAs. More details will be announced in the third quarter of this year. From the first quarter of 2026, the maximum speed limit for PMAs on public paths will also be reduced from 10 km per hour to 6 km per hour. Bay explained that 6 km per hour is the same speed as a brisk walker and is a reasonable limit since PMAs are meant for those with walking difficulties. Additionally, PMAs used on public paths must not exceed 70 centimeters in width, 120 centimeters in length, 150 centimeters in height, and a laden weight of 300 kilograms. These restrictions align with existing regulations for PMAs on public transport. It will also become illegal to display, advertise, or sell PMAs that exceed these size or speed limits. However, existing users with PMA speeds up to 10 km per hour will be allowed to continue using them until the end of 2028, as long as they comply with the new 6 km per hour speed limit and size restrictions. The exact timeline for enforcement depends on when the necessary legislative amendments are passed in Parliament later this year. Bay said there would be sufficient transition time for users and other stakeholders. The Land Transport Authority reported a fivefold increase in PMA lookalike offences in 2024 compared to the previous year. An LTA spokesperson said on 21st February that 38 offences involving PMA lookalikes were recorded in 2024, a sharp rise from 6 cases in 2023. Common violations included riding non-compliant PMAs, using PMA lookalikes, or riding e-scooters on footpaths. Other cases in 2024 involved 3 riders caught using non-compliant devices or exceeding the 10 km per hour speed limit. The number of PMA users caught riding illegally on roads also increased to 12 cases in 2024, up from 4 in 2023. The announcement sparked significant discussion online, garnering over 1,300 comments across CNA, Mothership, the Straits Times Facebook posts, and Reddit, with many netizens calling for the immediate implementation of the new regulations on personal mobility aids. Why wait till 2026? Please have a look at how many of these have been misused. They were speeding along the walkway in HDB estates, especially in the evening, one user wrote. Another user argued that the regulation should take effect this year, stating, "It should be pushed forward to this year. I've seen so many PMA lookalikes going as fast as buses or cars. Some even ride on the roads at night when there's less traffic." Concerns about safety were widely raised, with users citing past accidents, injuries, and even fires caused by reckless riders. One questioned, why not now? How many people are getting killed or injured? Or how many houses have burned down because of ignorant riders? Several users felt the measure was long overdue. One pointed out that requiring medical proof should have been enforced much earlier, commenting, "This should have been done long ago when you allowed this toy on the road. Why wait until a serious accident or death happens before taking action?" Another user shared similar frustrations, stating that the regulation should have been implemented much earlier, as many able-bodied individuals were misusing these devices, causing public nuisance and disrupting transportation. Many netizens expressed doubts about whether the new regulations would be effective without strict enforcement. You can have all the rules and regulations, but if there's no serious, strict, and persistent enforcement, they will only look good on paper, not in reality, one user remarked. Another raised concerns about LTA's ability to monitor violations, stating that rules are useless without checks. They pointed to the situation at the Toapil overhead bridge, where no one follows the no riding sign due to the lack of cameras or policing. One user also questioned the effectiveness of the regulations, arguing that laws are meaningless without active enforcement. They wondered whether LTA would hire a larger team to conduct random spot checks, and if an online option would be available to report users who are clearly not medically unfit. Besides enforcing rules on users, some netizens suggested that authorities should also target sellers and suppliers to prevent unapproved PMAs from entering the market. One user commented that merchants and suppliers must be held accountable if they are found selling unapproved PMAs. Another commented, if a rider is caught with a non-compliant PMA, the shop that sold it should also be punished. There's no point treating the symptoms if you don't cut the roots. One proposed stricter measures, such as allowing only one approved PMA model under government regulation. The user suggested that it be sold exclusively at hospitals, requiring a medical certificate for purchase, with all other models banned and phased out.